At Orthopedic Pain Specialists, we refer to people as clients. We do not refer to them as patients. And the reason that is, I believe that in medicine, there is a culture that has been bred over time where a patient's time value is down here and a doctor's time value is up here. And that's an imbalance that cannot continue in the future of healthcare. A patient's time is as valuable as anyone's time. And so I think in order to change a culture, you have to start from within. So I saw in training that if we made people wait for an hour, it was acceptable. Nobody got upset on our side of the equation. Everybody got upset on the other side of the equation. The patients were expected to wait patiently in the waiting room. And we're not okay with that. There needs to be an equalization of time value. And the reason we started to use client is because it starts to build that sentiment into everything we do. If everyone that comes in our door is a client, the mindset from there forward is that we need to hustle and make sure that that person is being tended to, not a patient. Because across medicine, patient, they just don't care about waiting. Everybody cares about waiting, especially when you can order Starbucks on your iPhone, so you don't have to wait in line to even get it. It's ready when you get there. So why can't we do that in medicine? And so once again, I believe that starting from within, rebuilding the culture, starting with the concept of a client rather than a patient is a good start. And so one of the things we're always watching is, how long did it take to get the appointment? Were the people on the phone, were our people answering the phone responsive? Did we tend to your needs? Did we answer your questions? Did we get you in a timely fashion? And then once you're here, I want people to have to fill out as little paperwork as possible. Everything's going digital anyway. So when you go to a doctor's office and all of a sudden you have 8 pages of paperwork to fill out, why are we still in the Stone Ages? Why can't we step up and be more in the digital age? So that's part of it. And then the other thing that's very frustrating to a client is if they're having to answer the same questions 3 times or 4 times, fill out the paperwork online, fill out more paperwork when you get to the office, come into the office, into the exam room, then have an MA ask the same line of questions that you've already filled out on paper, yet they're filling out in a different medium. Then have the doctor come in and ask the exact same questions. Why does that need to happen? Our philosophy here at Orthopedic Pain Specialist is you enter one data point one time and it is carried through your chart no matter who you're speaking to. And even if we refer for a procedure or for an MRI or for physical therapy, we've taken that information, that data bundle, and we've pushed it in a HIPAA-compliant fashion, protecting your information, to the next caregiver with your consent. So when you show up as our client to a place where we've referred you, you don't have to fill out information again. You may have to sign off on 1 or 2 disclosures, but that's it. You won't have to fill out these arduous paper documents asking the same questions that you've been asked 5 or 6 times. And so we value your time. The underlying philosophy is respect. We need to respect your time as much as you respect and value your time. So if we go into every interaction with that concept being pushed forward, it should be a good interaction. And that's what we're striving for. We're striving for the best interaction possible and the best outcomes possible.